Has it?
You've been on the right the whole time. Well, it's gonna drive you.
That's true. Maybe I should stick with it. I don't know. No, it was just, now it's better. It's good. You know what? It really brings up my eyes. Yeah, if I don't win this week in fantasy, I'm just going to call it, man. I'm just going to stop paying attention to my team. I'm going to just let fate take it.
I think with your flex, I don't see a loss.
You know, I got the app or the phone. I only have a few notifications on. I got text messaging, calls, and fantasy football. Everything else is notifications are turned off. So it popped up and it was like something like, just so you know, Taysom Hill can be played as a tight end. I was like, what? I got that double quarterback system coming at you? Like, what kind of offense is this, Luke? Is this that Springfield College wing T? Triple options, yeah.
Do you think I should start Marvin Jones this week or Antonio Brown?
That's a tough call, buddy.
I have Evan.
I wouldn't even listen to me. I've been terrible in our league. You're going to do the opposite?
No.
What's the projections?
Well, Marvin Jones is projected for more points.
I mean, I usually just go with what the numbers say. What's the matchup? Like, I know that the Bucks are playing the Rams, and the Rams have a good pass defense. I think the Rams might have like one of the best pass defenses in the league. Yeah.
Yeah, he's playing CAR, and they're 13.
Carolina, yeah.
So they suck.
13th is like middle range, you know what I mean? But I think I think the Rams might have the best pass defense in the league.
I don't know. Some weeks he doesn't catch a ball for like 4 weeks.
Mike Evans is hot and cold, yeah, for sure. He's totally feast or famine. But when he feasts, he'll like drop like 30 or something like that. Who do you have? Drew's got some firepower, man. The Cardinals already played, so you know Kyler Murray's at least out of the equation. He didn't have a huge week either. You got to account for these things. Bye weeks bite you in the ass. This season is like the most confusing fantasy football season of all time, too. It's unreal. Are we're good to get going? Okay. So we're recording this too? Amazing. I like all the people in other countries that like don't give a fuck about American football are just like, what is this guy even talking about right now? Only the best thing ever. American football, fantasy American football. Makes all your fantasies and dreams come true. Yeah, well, before I answer anything, I'll just briefly sort of like recap, like, you know, if you should have the PowerPoint. Everybody has that. The PowerPoint's pretty useful from the perspective of, you know, you have these principles of progression, and they tell you kind of what the rule book is for where to start people exercise-wise. Then if you actually get to the sections on, like, you know, core pelvis, hip dominant, whatever section you're in, they're organized the same way, where they'll actually follow the principles of progression with the way that they're laid out. Like if you encounter a pattern, the first thing that you should see, the first slide under that pattern for exercises will be the sagittal plane bilateral stance exercises. And then they'll be listed like, here's number 1, 2, 3, 4, on and on and on. And the way that they progress is based on the principles of progression being shown to you. But to me, it's the number 1 exercise is usually a big deal, because it's like, that's my conception of putting everything together for giving people the best opportunity to be successful with the concept that I'm trying to get across to them. And for the most part, what we did here with this workout was throw a bunch of ones at people. We tried to go along with this model as best we could. And even with that, like, I try to do the least amount of coaching I can. And every exercise that was selected was like risk management 101. It's like nothing's going to go wrong for the most part, unless I never say that, but I think I chose things that had very low risk potential associated with them. So even if it's like, oftentimes I'll call these things pizza exercises. And what does that mean? A pizza exercise, like pizza, even when it's bad, it's still like pretty good. It's okay. When pizza's really good, it's fucking amazing. All right. But even bad pizza's like, it's still fucking pizza. Like, it's fine. So, let's say the goblet squat was just butchered. It's like, it's still fine. Like, they're still doing something. I've seen a million people do a million terrible fucking squats. As long as the load isn't excessive and crazy, they're going to live to fight another day. So it's very low from the perspective of disaster potential. And then you can see, like, as we go through this, I start coaching a little bit more and more and more as that thing breaks out. I want to show you, like, hey, even, I'm not going to go crazy in the beginning. I'm going to let them enjoy themselves, kind of let it have fun. But then by the end of it, I want to show you, like, if we really focus on this cable pull through, like, I can dramatically change the hip hinge by applying these competency concepts to it and these propulsion arc concepts to it by understanding what kinds of joint actions I want to give to the person based on what's happening in their body and what the movement is all about. And it's like, all of a sudden, like, you were talking about the lat pull down, and it's like that thing just went bananas on you. Like, this blew my mind. This isn't the same exercise that I've ever done before. And that's something I expect out of this. Like, I expect this seminar to be only big deal concepts from the beginning to the end. It's like, if you sign up for a seminar and you get like 3 takeaways for the weekend, are you kidding me? Like, from the moment it starts to the moment it ends, it should just be like, these are high yield concepts that you're getting. Every exercise and every demo should be like, what the fuck? Are you kidding me with this? Like, that is crazy. I've never seen a lat pull down give somebody that kind of response. That's what I expect out of this thing. All right. That's what I expect when I'm working with somebody that can kind of know what they're doing to some degree. When you poor souls go through this advanced workout, like, you're going to be getting into some good positions for some frontal plane and transverse muscles, and you're going to really experience some stuff with that. All right. So that's just kind of like the sort of my thoughts regarding the workout session you just watched. And I also want you to see, like, again, like, I'm not particularly interested in changing what you do. All right. Like, there's probably nothing in this that you're like, I've never seen anybody do that in a workout before. It's like, man, I've seen a million workouts. I've seen a million people hinge. I've seen a million people fucking squat and pull and push. I didn't pick anything that was like really weird. Okay. What did we do? We did some running form drills. We ran. We lifted weights. Whoa. It's all the shit you've been doing. Okay. The difference is the standards applied to the way that you do them that follow a very specific list of recommendations. And those recommendations are based on very specific reasons for why they're being implemented. So it's the how and the why, and then the when we do things that becomes, to me, the big deal. That's how we kind of reevaluate training. It's like the exercises that exist for a reason. Like, from just a purely evolutionary thought process, it's like the best vetting process is time. Time vets better than anything. Like, if something exists and it's been here for a long time, there's a reason why. Maybe you can't see it. All right. Like, there's factors that you can't even possibly imagine. Like society, like there's parts of society where you're like, why do we do it this way? And then you try to take it away, and then the fucking world falls apart, and you're like, didn't see that happening. And it's like, well, it's been this way for a long time. And the reason, like, I don't know why Seneca thought process, I'm not sure exactly mechanistically how this all fits together. It's a tangled web in a lot of ways. But if I pulled the web in the wrong way, I couldn't even believe how it affected the whole thing. Holy shit. That was dramatic in ways I couldn't have even imagined. All right. The exercises that have survived the test of time, I'm like, there's a fucking reason they're still here. Most of these things work. I'm not trying to throw out all the exercises that have worked for a really long time. I'm just trying to go in on them with like a laser guided scalpel to be able to dissect these things and put them back together again in a way that I think optimizes them for more people. That really is kind of where I'm at in terms of what I want this to be all about. So let's see what kind of question we've got, and then I'm going to show some assessment stuff. I didn't give myself much time for assessment because I don't need much time because this isn't an assessment course.
When talking about how air will fill gravity-dependent loads first, would there be any benefit to inverting someone to some degree to optimize expansion of what would normally be the upper parts of the lung, and then try to train whatever movement they like there for carryover to when we return to an upright position?
Yes. So I'll repeat it just in case people couldn't hear with the mic and stuff like that. The question was basically like gravity, or I'll start with a statement, like just so I can organize it in my head, and hopefully I get it close to the way that the person asked the question. If I'm standing upright, gravity is going to dictate the fact that I'm going to fill the bottom of my lung first, and I'll fill the top of my lung last. If I invert someone, I'll fill the top of my lung first. It's now the bottom. You know what I'm saying? So is there a benefit of inversion? And the answer is yes. It's a great way to be able to think about how all this works and use a very simple adjustment to drive air into a region that you're desiring to drive air into, okay? You're going to put volume into a space that usually lacks volume just simply by switching the orientation of the whole person relative to gravity. It's a really good solution, okay? I don't remember, like the second half of the question seemed to go in, it was a long question. It was something about, should I invert them and then do movements?
To some degree to optimize expansion will normally be the upper parts of the lung. And then would you try to train whatever movement they lack there for carryover to when we return to an upright position?
So would I try to train motions they lack there for carryover to an upright position? Possibly, but you just got to think, like if you invert somebody, there's a lot of logistical things going on. Like their hands and arms are probably going to have to be on the ground. Like I'm not going to have them balance on their forehead or something. The other thing, like I don't need to put people into a handstand for this. Like if I do that, that would just be a really difficult position to deal with in terms of managing gravity. Like that's the hardest position I could possibly put someone in to manage gravity. It's funny because I've gotten this rap as like the handstand hater, and it's like I really don't hate it. It's just that it's like the reasons that people say they're using it are oftentimes like I disagree with the end of their conclusions from like a logical framework perspective. So it's almost like people will sometimes say, like my goal is to overhead press more, so I'm going to do handstands. It's like I don't think that's the best path towards that. I would probably overhead press effectively to improve my overhead press. Or you'll hear like I'm doing handstands to improve posture, and I'm like, how do you measure posture? No answer. If you did know how to measure posture, I don't think that handstands would be the best pathway towards getting the thing that you're after. It's just like, it's a choice. I just think it's a bad choice for those outcomes. If you're doing handstands because your goal is to get better at handstands, I'm like, makes perfect sense to me. Then I'm like, why is your goal to do handstands? And then it's kind of like, if you have whatever, this is something we got into again, mentorship. Like, I am never actually going to have, there's very few times where I'll have a problem with your goal. Your goal is your goal. I'm not here to judge your goal unless it's like, my goal is to murder all of the puppies in the world. You know, and then I'm like, whoa, this is a fucked up goal. Somebody needs to do something with you. We're going to lock you up because your goal is fucked up. Okay. But as long as your goal isn't completely fucked up, like murdering all the puppies in the world, I'm not going to judge you on it. Like, you know, if you're like, my goal is to like make my waist as small as I possibly can and make my ass as big as it can possibly get. I'm like, okay, yeah, sure. I don't know exactly how I'm going to help you with this other than like diet and maybe like, you know, only hinging and maybe like, I don't know, we'll put you on like the Brett Contreras plan and like a diet. Okay. Like, I don't know what else to do, but like, I'm not going to, I mean, I might judge you, but I'll just keep my mouth shut. Like, you know, but it's your goal. Like, I'm not here to fuck with your goal. I'm here to try to help you towards it. Where I will disagree with you is when you're like, this is my goal. This is my method for getting there. I'm like, well, your method sucks. There's so many things wrong with your method. Now I'm going to go ahead and critique your methodology for getting to the place that you said you wanted to get to. And that is the thing I've had a problem with a lot of people that are like super handstand focused people. I'm like, I just think your methodology for the place that you're trying to get is not great. End of discussion. Or not end of discussion. I'll give you reasons why, and we can have a conversation. It's just we have to have the framework for the conversation established pretty effectively. So when I think about inversions, people always take it to like, we're going to do handstands. And I'm like, I'm probably just going to put your knees up on a box and I'm going to like have your hips higher than your shoulders. And then we're going to do probably core, thorax, and pelvic kinds of work. But your hands are going to have to be supported somewhere. I don't know what motions this person's talking about in terms of trying to train. Like, what are we trying to train here? Like just moving the hand a little bit or something? Like, so I'm like, I can't like practice rowing in that position. It would just be like really awkward. So I don't know. It's a position that's super useful for putting air into the right part of the lung if your goal is to put it into the top of the lung. But the logistics might make it hard for the thing that they're talking about. Let me get into the assessment just so we can, you know, I take longer than I should for answering questions sometimes. You want to come up here? And what's your name again? Kevin?
Yeah.
Kevin, I'm going to have you lay on your back. I'm going to bring Kevin through. Whichever, I'll just orient around you. I'm going to go ahead and assess him the way I assess everybody. So I'm going to check arms and legs, and then I'm going to check in for sternal angle. So I'm going to take a look at all planes here, and we'll see what we get. So I'll start over here. We're going to do flexion. Now, when I do flexion, I have to make sure his olecranon is basically pointed straight back this way. Everybody tries to do this stuff, and I'm going to get some kind of like funky readings here. I want to see true flexion here, and if I'm going to get true flexion, I have to keep his arm from orienting too far into IR. So olecranon, bang, right there, and we're going to see where we get to. I'm not going to go crazy and press this down super hard. This is about where we get to, right? Like if I push any farther, you're not going to be super happy. And it's kind of a pretty solid end point right there. You've got a pretty good vantage point. What did you say for degrees this is? 160? Yeah. So I'll go ahead and I'll check the other side while I'm kind of here. Same thing, olecranon this way. And that's about it right there. I like doing that to show I'm not like faking tests and stuff like that. Similar, close enough, a little more. 155, similar. Okay. So I'll check ER, IR over here while I'm here. I'm not going to go, I'm just going to hold him in place. Nothing crazy. I didn't think it was going too far, but that's where, I mean, look, I'll do this just to show like I'm not messing with tests and stuff like that. What do you think that is degrees wise? 40? Something like that? 45? Put them right there, like 45. We'll go ER. It's not full. Maybe 80, something like that. Okay. I'm going to bring you over to this edge of the table so you can come over till you bump into my hip. And that's perfect. We're going to go horizontal abduction. I'm just going to kind of control it at the humerus, and we're going to see where it gets to. That's it right there. So, you know, it's above the table. So what did you say? Like it's probably -3 degrees or something like that. What we'll do is you can just move a little bit more towards the inside of the table. Actually, you can bring that arm back in. I'll have you break dance. So you're going to put your head down the other end, feet down that end, still on your back. People always like that reference. So we'll do the whole ER, IR thing on this arm. So it's kind of similar, right? About 45-ish. I mean, I'm not a human goniometer. I'll try to get out of the way of the camera. So that's pretty close to full ER over here. It's 90. We'll give them 90. If you want to come over to the edge of the table, and again, I'll try to get out of the way to be able to show this. He's got more over on this side. Okay, he's able to horizontally abduct to a greater degree. Not much, but maybe a few more degrees. Now, the only test I didn't get so far are just the horizontal adduction. So I'll check that here. Go ahead, allow this to bend. And I just cinch in right here, kind of like where the lat attachment is, just so that a lot of times you'll get like a false reading if you allow that to move too much. So I'm just going to kind of keep them blocked here. And if I'm looking at this from this angle, which you may not really be able to see from the camera, I see basically, I just relate it to where it is on the face. His elbow makes it to where his cheek is, like his zygomatic arch is basically where his elbow gets to. You can move more to the inside, the middle of the table and relax that arm. I'll just check horizontal adduction of this arm. And it's pretty much the same thing. He might have a fraction more horizontal adduction of this left arm. It's basically where his eye is where his elbow is. So now I'll check legs if you just want to slide a little farther back here. And so that's all the plans with the arms. I'll get this leg first. We're going to look at flexion. And that's basically where it ends right there. And what do you think here? Maybe 110, 115? If this is 90, maybe 120? 120? Okay. How's this one in comparison? About the same. Okay. So while he's here, I'll check ER and IR. Okay. You got a pretty good view on him here. 30? 35. Maybe 50? What am I looking for on those ones? For IR, about 45. For ER, about 60. Okay. We'll see what we got over here. Right to 90. And what do you think? 20, 25. So we had 35 and 25. And we'll take a look at ER. 50. Similar ER. All right. We're going to take a look at adduction and abduction. So I'm going to have you just go to your side. So sideline. And you're going to come back to me till you bump into my hip again. And you can bring your knees up to here. So I'll check hip extension from this position too. I find I have a much better vantage point on hip extension. If I could get those 2 AirX pads behind you, I'll just give him a pillow so he doesn't have his head hanging in the air. Hey, whoa, buddy, you just coming in and smashing the place up? So if I'm doing this, like you can just relax, nice and easy. I use the Vulcan grip on the hip, like very important stuff here. But I kind of find like his ASIS and his PSIS, and I sort of drop my hand right in the middle, and that kind of puts the spread of my middle and ring finger right on the greater trochanter over here on the side. I've got really good control of his hip. People like it when you test them and you feel like you actually have good control over their pelvis while you're doing this stuff. You got a demonstration outside. So when I'm going and checking this, I'm gonna first bring him through. First of all, like I get a feel for the leg. You know what I mean? I'm like, hey, relax this thing. Let's see what kind of tone and tension we have. And after you've moved a bunch of hips through the zone, you're like, okay, this thing moves like butter, or this thing's a little sticky. Okay, so this feels like a little sticky to me, but I'm gonna move him flexion, abduction, ER, and I'm gonna start. See, if I let go, he's just so toned up, this thing just hangs, like he's holding it himself. Let this thing relax. Bang. Okay? So I need a relaxed person to test. Good. And when I bring him back, I have to make sure that his pelvis doesn't rotate back into me. I'm going to keep his pelvis stacked, and I'm going to bring him back. And basically, this is the end of his hip extension. So he's probably, you got a pretty good look at this, maybe 20, 25 degrees short of full hip extension. So 20 degrees short of hip extension over here. So even if I adduct him, it's not a real fair test, but I'm going to let go of it and show you where it ends. Okay, right there. And when I drop it, he goes even further back into hip flexion. So if you can't extend, extension, adduction, internal rotation, it's all part of the thing. What I'm always curious of, relax, is do we have more hip IR when we test it this way as compared to the other way? So you have a good look at it. How much IR does he have for his hip here? It's like full, 40, 45. How much IR did he have on his back? 35. The difference here is I took all the volume and expansion from this side, I sent it that way with gravity, and I compressed his hip more just due to the nature of gravity pulling things away. And if compression feeds compression. If I compress the hip, I'll witness it with more IR, okay? You know, it's just, it fits in with the whole model. So let's take a look at abduction. And what do you think here? We got people looking at it from over that way. Maybe 40, maybe 35 is, I can't really hear you that well. 35? Okay. So we're going to break dance. We're going to send your head down this end, feet down the other end. And come back to me till you bump into my hip. That's perfect. We're going to come up to 90 with the legs, and we're going to take a look how this side is in comparison. Relax this thing. Yeah, there we go. I'm going to just move it around, get a sense of how this side feels. Flexion, abduction, ER. I'll try to bring him back from here, and his pelvis is trying to rotate into me like crazy. That's okay. If I just let him rotate back, it's going to give me what looks like hip extension. It ain't hip extension, okay? If it's here, this side can get to right about here, and it's sort of done. So it's close to the other one, maybe negative 15, something like that, okay? Is it going to adduct? See, he wants to give me compensatory IR to adduct over here. Watch what happens if I actually IR his femur. He'll adduct. No problem, okay? I'm trying to actually get a sense of adduction, though, so I don't want to feed him too much of this kind of pseudo compression IR sort of fake stuff here, okay? If I keep him right there, that's where it ends, okay? It's just hanging there. It's not going to adduct. So we'll see. I already know he's going to get better IR and side lying here. You know, he had pretty limited on this leg, 20 degrees. He's got about 40, 45 degrees here. You know, that just tells me he is going to struggle with getting into that motion if I don't really create a situation of managing gravity that's as easy as possible. And for creating unilateral IR, the easiest way to do that is to put him in a side-lying position where I have the leg that I'm looking to get IR on be the top leg, because I'm going to drop the volume and fluids right out of that space. I'm going to take away the expansion from it. And if I take away the expansion, I'll be able to compress it. So let's take a look at abduction here. And a lot less than the other side, right? So how much is this? Maybe 25, about 10 less than the other side. So I got a bunch of measurements, okay? I've got, let me think about this. For his legs, we had about 120 degrees of hip flexion. We had, in a supine position, we had 20 degrees of IR on the right leg, and we had 30 degrees of IR on the left leg, 25 IR on the left leg. We had abduction on the right leg at 25 degrees, 30 degrees, I think we said, 25 to 30. On the left leg, we had more. We had about 40 degrees of abduction on the left leg. So those are kind of our starting numbers. Couldn't adduct on either leg. Extension on the left femur was negative 25. Extension on the right femur was negative 15. For the shoulders, he had about 160 degrees of flexion. He had a right shoulder that was about, let me think, he was like 40 degrees of IR on pretty much both of them. His right shoulder had full ER. His left shoulder had 80 degrees of ER. His right horizontal adduction got to the outside of his cheek. His left horizontal adduction got to his eye. His left horizontal abduction was negative 3 degrees. His right horizontal abduction was 1 degree. So those are the measurements that I'm working with here on this guy. Okay. Now, so I know he doesn't have full movement variability. And I would say full movement variability is the ability to demonstrate full measures on all table tests. You've got human norms, okay? Do I know whether he's biased towards compression or expansion based on his table test results that I've accumulated thus far? No. I have no idea which archetype he's biased more towards, okay? What do I have to do to make that next jump from a determination? I have to take a look at the infrasternal angle, okay? I'm going to put you supine again, all right? And now if you could just pull your shirt up, we'll take a look at what we've got here. And we're going to have to get you to relax your stomach, really relax this thing. This guy's carrying around a lot of extra tone, okay? Like, I want to get my fingers in here. I want to touch your guts, okay? You got to relax. Let me do that. It's super comfortable to have another man just trying to jam his fingers into your guts. Yep. You can get all up in your guts here, all right? But let's learn to go jelly belly here and relax this stuff. Just what I'm going to have you do, we're both going to do this. You're going to have your left hand right there, and you're going to feel how much can we relax this tissue? How much can we just let this go? Because I can't really get a sense of what his rib cage angle is if it's just like we got abs on, like, you know, super high level tension. We're getting there. We're getting there. As I'm doing this, I get a feel for like where his ribs are though. Like I'm doing this at the same time. Like I need to get a general sense of the shape of his cage, and we're relaxing over time. We're getting there. Okay. It's almost like you need that sensory feedback to be like, hey, this spot right here, let this thing go. Just let me kind of get in here. Let's measure this thing. I'm starting to get there. And for me, it's kind of like, here's the bottom of his sternum. And we're going to get in here and I can begin to create this outline. And that's basically kind of the angle that his ribs are coming in at. Like here's his cage going this way, right here, getting a sense of the shape of this thing. And here's his cage over here coming this way. So if you can see that on the other side of my hands too, you can begin to kind of see the angle that we're working with. And I'll bring my hands up and away without changing them. And what would you say that angle is about? Maybe like 125, something like that. So I've taken a measurement here, and then I'm going to bring his arms up into flexion, so he might hit the camera if it stays right there. I'm going to take both arms, and I'm going to bring them to where I start to see his rib cage start to posterior tilt. So kind of go back and forth right there, okay? And I'm going to get a second measure right here, all right? And when I drop here, and again, we're going to try to relax this stuff. Try to relax this stuff. It's not easy, okay? And all the muscular action he's got is interesting to try to work with here. You have this on video, or yeah, no problem. Relax.
I've been trying to relax.
I know. Oh yeah, it's wrong word. It's very useful to say this to women when they're upset too. If you just repeatedly continue to say relax to them,
Always works.
yeah, it's guaranteed to work. And then if they don't, and you need them to get something for you, you just go. And that is how you really just like, yeah, yeah. So, I got great advice for life as well as exercise. So, yeah, just remember from a procedural standpoint, from a sequencing perspective, you go, okay, relax. Okay, yeah, relax yourself. And then if that doesn't work, then you're like, you know what, I could use a sandwich, okay? And boom, that's a surefire way to just have a successful, yeah. Yeah. Tell you what, man. So.
You're gonna check this out.
Yeah, 100%. Yeah.
You really need to relax on that one. Yeah.
The old IPA. The old IPA. Yeah. Okay, we're good. So, and that was fine. Like where your arms were, if you were pretty relaxed there. I'm just looking to see, you gotta bang. It's basically the same thing here in terms of the rib cage angle that I had before. It's still like over 120. So what that tells me is that this guy is going wide. He's wide infrasternal angle. And when I see that, I say to myself, compression dominant. He's biased towards compression. And I'm going to go ahead and try to feed this guy more expansion. Now, I'm going to be as lazy as I possibly can because it's before lunch and I want to use something that requires zero effort and zero anything. So I'm going to go with the old side-lying decompression strategy. Why am I going to go with this? Because, okay, so with compressed people, for the most part, we're looking and saying that this is usually going to be an anterior to posterior compression thing that's going on. And that which is happening at the thorax is usually also happening at the pelvis. It's like narrow people, infrasternal angle wise, and wide infrasternal angle people are using something to try to solve the same problem, which is trying to deal with a body that's turning as a biped in a gravitational field. It's a really difficult thing to manage, okay? You've got internal fluids that are turning, and your exoskeleton outside of that is turning in response to it. And then you're trying to then manage your body rotating in space. And if it's too difficult for you, you'll make the turning action, you'll reduce its options, basically. And a ball is the shape of something that can turn the easiest. What you'll see with an expanded narrow person is that they're going to be squished and they're going to be expanded A to P, anterior to posterior. A wide person is going to be squished A to P and they're going to be expanded laterally like that. So if I'm just thinking about this from that perspective of shape change, I'm going to make this as easy as I possibly can. I'll take someone that's going to be, in my mind, his test results and this infrasternal angle are telling me this guy is most likely squished A to P. I'm going to squeeze him lateral to medial now and use that to push him in the right direction, A to P. I'm going to do this as easy as I possibly can. I'm going to put him in side lying and I'm going to stack some shit on top of him to just literally squeeze him like a tube of toothpaste. Okay? So what I'm going to do is I'm going to use this first rack. Yes.
Just because we may have missed it while we were trying to reconnect, could you explain a little bit of what you were looking for when he put his arms overhead while you were testing?
Yeah. So You need to take a look at infrasternal angle from two testing positions. One with arms down by the side, and one with arms going up. I don't fully remember the explanation for this testing procedure. This is something that I got from Bill. But one of those places is going to expose a better place to measure from. And basically, like if you see an extreme measurement of either really narrow or really wide from either of those places, that's the measurement that you go with, okay? It's like you're looking to expose the truth underneath there, and either arms by the side or arms, it's kind of like, you know, zone 1 or zone 3, like I think in terms of arm position, but you're going to get a better sense of what's going on down here. 108.8. And the reason it's 108.8 is because when you examine helical sciences, a helix, a single helix that has 55-degree curves to it, is in a position where it can be equally expanded from there and equally compressed from there. That is exactly the middle. If I have a rib cage, which is a helix going this way and a helix going that way that creates an infrasternal angle, it's a double helix, okay? A double helix has a cross to it, and the angle that comes out of that is basically summation of a single helix and a single helix. 54.4 plus 54.4 is 108.8. That's the money maker right there. It's like your favorite radio station. If somebody's 108.8, you're like, I bet you're going to be able to fucking do everything training-wise, and I don't even have to coach you. You're just easy, all right? Like, so, and it's like when you see that, you're like, God damn it, it's like true every damn time almost. So when you see that helix get crushed this way, it's like it widens it out, you know? When it's pulled apart this way, it makes it more narrow in terms of the presentation. That was a great question. I should have said that in the first place. Okay. I'm going to bring him over here. We're going to leave him on the ground. I'll answer another question. I'm just going to need a little bit of help. I'm going to need one of those mats. We're going to do this. I'm going to retest them. We're going to break from lunch. I'm going to leave them on the ground for a few minutes. I'm going to need the blue AirX pad. I've got this one over here. There's sandbags that are behind these chairs. So if somebody could toss me that blue AirX. There should also be a blue pad that's oval shaped somewhere. I've got those two sandbags. I'm going to need there's the blue oval. People are like, what do you use the most in the gym? I'm like, this fucking blue oval. I don't even know what it's called. TheraBand. It's not a band. So I'm going to have you lay down. We'll have your left side up first. Okay, your feet are going to be going that way. Your head's going to be down here.
And left side up.
Yep, so right side lying. And that's going to be basically right in the middle of your rib cage, like where the bony parts are. This is going to be your pillow. Okay, I'm going to bend your legs up to 90 degrees, maybe a little bit less, right about there. And now we're going to put this sandbag on your hip. This is where I do this other places, and I'm like, I get it. It's so difficult to like find stuff and like put things on people. Here it's like, yeah, I mean, I have my hip sandbag, and then I'm going to drop a barbell on top of this sandbag. Oh, it's already on 5 pounds. Wow. So I'm going to try to center this on the sandbag. I'll need a little bit of your help to tell me whether or not you feel like that's kind of in the middle, or if it feels like it's going to roll to towards your feet. Or okay, so I'm going to pick it up. We're going to move you a little bit closer towards me. Good. Should have measured how tall he was before doing this too. This usually makes people taller. I'm not even kidding. And then you tell me when it feels like a good amount of weight. Why is this not working? Are you serious? Is that adding weight? You gotta be fucking kidding me. No, it's, you gotta be fucking kidding me. We're gonna have to move it over to the next rack. Not, fuck. Of all fucking times. I don't even know what's wrong with it, man. That's a big deal. And of course, it's got that goddamn trap bar on it, everything else. Yep. Well, yeah, because there's no barbell on this one, too. Yeah, there's no air in that. I don't know what just happened to that thing. Push the button in, pull it out. This is off the thing. Like, you gotta be fucking kidding me with this shit. Like, all right, this rack is also not working. Fucking goddamn it! Like, this is the shit. Fucking drives you crazy when you're trying to do this stuff. This does not happen. You're on there? All right. That's going to go in the ribs. I'm going to flex those legs up a little higher. Okay. You're going to tell me when you feel like you've got a good amount of resistance on this hip, or? All right. People usually know there's a gray sandbag over here. I'm going to put that on his ribs. This thing's 50. Right there. That feel pretty good right there? All right. So we're going to let him hang out there. If those things fall, somebody can just put them back up there. So we'll time him. I'll give him 6 minutes. And while we're doing that, that's frustrating because, you know what, like, first of all, that first rack's, I don't know what's wrong with it. That does not happen. But now it's like I got a problem for the week, too. And, of course, you go over to the second one. It's like the thing's off the runner. How the hell does that happen? And, you know, when you pay a lot of money for things, it can drive you crazy. It really can. Like, you're like, if this doesn't work, this is going to be a huge problem. So while he's there, we got 6 minutes to kind of explore this topic of what's going on here. Why do I come up with this solution for this guy? Number one, it's literally zero effort for the most part. I just set him up. I don't coach him. Like, just stay there, relax. Don't try too hard. Don't do anything. Just let yourself get crushed by those weights. So it's really hard to screw up. I try to coach exercises, really easy to screw those things up. So number two, I talked about kind of these compression pieces. And what I'm going to add to this is I look at this guy and I say to myself, he's definitely lifted weights in his life. He's definitely been strength trained. He's made progress in that area. He's probably done a good amount of like upper body and lower body, bilateral, symmetrical, stance, sagittal plane work. What do I know about things like that? And the answer there is that when people are doing kind of big upper body movements, like a bench press, for instance, we think of it just like pecs working and pecs kind of moving, a humerus and pecs attaching to a clavicle and a sternum and other things like that. But pecs also create an anterior compressive force that's going backwards, okay? Now, when that happens, it's literally pressing the entire anterior thorax towards the midline and like towards the spine, all right? Now, when you do something, and like what does that kind of look like when I'm pressing the anterior thorax towards the backwards towards the spine? You ever see an action movie or something and somebody gets kicked in the chest and it's almost like, oh shit, like it internally orients the humerus. So I'm kind of like, I'm this person when I've done a ton of anterior compressive work, all right? Now, what about when I'm doing a lot of like upper, like even deadlifting, rowing, where it's kind of like I'm creating a lot of this posterior compressive kinds of work? It's almost like if I got kicked in the spine, oh, like that, like it's going to posterior rotate and orient my humerus and structures of my upper extremities. What if I've done a ton of resistance training overall and I've squeezed both sides at the same time? You mind if I just use it real quick for this? I'll just have you face forward for this. Like if I squeeze him super hard in both directions, you see where his arms go? They just should flare out to the sides, right? Is that what I can't see because I'm like just focusing on squeezing him. That's what happened. That's all I needed for that. I create imaginary lat syndrome person, okay? When you're squeezed on both the front and the back at the same time, whoop, I just pop out like that, okay? What's happening there is I squeeze the front, it orients the glenohumeral, it orients the scapula so that the glenoid fossa is going forward. If I squeeze the back, I would orient the glenoid fossa so it was kind of aimed back. If I squeeze both at the same time, I'm literally just pushing the glenoid laterally out to the sides, whoop, like that. But I'm just seeing that as an outcropping, an outcome of having a front and a back of a thorax squeezed towards the middle at the same time. That's what I'm witnessing. I'm not witnessing somebody doing something weird with their arms. Their arms are doing something that makes perfect sense in response to what's happening from a compressive force standpoint on their on their thorax, okay? Same thing for the pelvis, okay? It's like there's small muscles on the front side that attach to the obturator, like things like obturator internus are ones that can create anterior compressive forces going back. Along with adductor magnus can create a lot of anterior forces pushing back at the level of the pelvis. Glute max can create a lot of posterior compressive forces going towards the middle, okay? If I've created a lot of anterior compressive forces at the pelvis, it's going to orient my femurs in. If I've created a lot of posterior compressive forces, it's going to orient my femurs out. If I create both at the same time, it's going to turn me into a chimpanzee, okay? It's going to just splay my legs out. It's going to give me the equivalent of imaginary lat syndrome at the level of the femur, all right? So I'm not going to try to approach this by fixing the legs because they're just doing what they should be doing in response to the forces that are taking place at those points. I'm going to approach this by trying to squish the thorax and the pelvis back to the place that I think it should be at to give the orientation of the sockets for the arms and the legs their best opportunity. It's like I'm not going to be the hinge guy, you know? I'm not going to be the frame guy. I'm not going to be the floor guy. I'm not going to be the wall guy. There we go. I'm going to be the person that looks at the whole system and kind of analyzes the entire structure and the way that each thing influences the other thing. That's my goal here. So I'm going to come over and get my guy. That wasn't so bad, was it?
Nope.
All right. I'll take these things off. It's real nice when they come off too. You're like, oof, that's really relaxing and nice. So we had a 50-pound sandbag on his thorax, and I had a 40-pound sandbag as well as the air is just not working here today for some reason. I don't know what's going on with that. That could be a huge problem. We're probably going to have somebody have to crawl down into the basement this week or something, which is the worst job in the entire gym. Not doing it. Yeah. So he should feel a little weird coming out of that, right? Like it's almost like what's happening here. So we'll bring him back to the table, and we'll see whether or not we've changed anything. Because ultimately, you can postulate all you want about mechanisms of skeletal shape change and this, that, and the other thing. What I'm really after is just normalizing range of motion so that it's close to human norms, and I want to see if I can use the easiest way to get there. So we'll kind of rip through these tests again. So I'll take a look at shoulder flexion. And where is he at now? I need a number. 170. Okay, 0 exercise, 10-degree difference. Where's he at now? 175. While I'm here, I'll go ahead, bend your elbow. All right. What do we got? I mean, I'm not in a great place to see it. You guys got to speak up a little bit. 55? He was at 40 before. This was full. It's still full. We'll check his horizontal adduction while I'm here. He was getting to his cheekbone before. Now he's kind of at least at like near he's kind of in the middle of his eye on this side now. We'll check this side. So we'll get IR, ER. Nice and relaxed here. So it's hard for people. You guys can maybe see it in the mirror. I just don't like to be the guy that calls out the numbers on his own test. It's 70, okay? Relax, relax, relax. He keeps trying to help me. That's pretty full there. That one was really limited before, if I remember. We'll see where he's at for horizontal. This is clearing now. He's at the midline. He's reached his nose with this one. We'll check horizontal abduction. I don't think I'm going to clear this one up with this particular, so I need you to just come over to the edge here, and we'll see how far this can drop. And it's pretty similar. It's a little better. I'll talk about why I don't think this one really clears up that much. You can kind of break dance if you want. We'll show this arm on this side. And I think that's at least below the table now. Okay, it was above the table before, so it's a little bit better. You can stay where you are. You can go back to the middle of the table if you want. We'll take a look at what we did for legs. All right, so he was at 120 degrees before. Where are we at now? If I'm in your way, I'll get out of your way as best I can. You're saying 140? Okay. I'll check IR while I'm here. That's full. Okay. I'll check ER while I'm here. 50. Where we at? 130. What do we got? 45, 50, so full. Pretty full. 60. Okay. So let's check abduction and adduction now. So go ahead, sideline. And I don't have a second one here. I want to get that second blue one because I got to make it the same. There we go. So this abduction, if I remember correctly, was pretty limited. Okay, he was at like, I want to say, what was it? 25, 30, I think it was like 30-ish, yeah. So, just relax. All right, that's a dramatic difference. Okay, I mean, I primarily went after his pelvis here with these things, so I kind of expected that. So nice and relaxed. He's got much more hip extension now. That's pretty damn close to full. And we'll see, he doesn't really adduct yet. But I mean, look, like even if you get a pretty substantial increase in hip extension, just that is a great thing. You're like, God damn, that's pretty good. I'll take that. Let's break dance. I'll have you go the other way. And knees are coming up. Right there is fine. And we'll see what we've got for abduction first. And this side was a little better. I think it was 40, if I remember correctly. And we'll see where we're at now. I have no idea what you're saying. 45, okay. So, I mean, we were pretty close to what we wanted anyway. So the other side was the one that was the big problem with that one. We'll see what we've got. This hip extension was more limited. This one was negative 25 before. Nice and relaxed. So now we're pretty much close to full hip extension there, and maybe negative 5 or something like that. We'll see if he adducts. A lot better than before. Okay, so you know, the reason I show this is because I'm about as lazy a person as you'll ever meet in your entire life, quite honestly. I want to do zero coaching. I want to do zero work. I want to get the maximum reward for doing absolutely nothing. And for the most part, I got a lot accomplished here with this guy's table tests and movement potential with literally doing nothing, okay? I just lay him down on his side. I stack some weight on him so that I just use gravity and force to be able to shape shift his skeleton to a place that I want. Now, we're going to take a look at his infrasternal angle as the last part. So if you want to go ahead and lay on your back, we'll take these away from you. Just pull that up a little bit more. And yep, just relax, arms down by the side. Okay, there's a lot, actually, the interesting thing here, I wish the camera could get this, there's a lot less tone abdominally for him. Feel that yourself, like, feel it's just like a lot more relaxed. Okay, so let's see what we've got now from a rib cage shape perspective, and that's a very different angle. Okay, so what would you say that is? It's like just a shade over, you know, it's like closer to 100, okay? It's definitely reduced quite a bit. We'll bring the arms up just as the other kind of a test. The other arm has to go too. Right there is perfect, relax. And I check here, and it's still the same kind of a thing where it's like closer to 90, 100, okay? So relax. So, you know, I'm looking to create skeletal shape change. That's kind of my goal. Like, what do you think muscles do? They create skeletal shape change all the time. We just can't see this part of the skeleton as much, and this part of the skeleton really runs the show. If I can change the shape of this part of the skeleton, I'm going to influence the way that the arms and the legs move to a tremendous degree. I mean, that's really what I'm after here. I want to do it as easily as I possibly can. If I have a really good idea about what shape I'm working with and the opposite of that, I'm going to increase the probability of creating the change I want to the greatest degree that I possibly can. All right. So let's take a break for lunch. We'll give you an hour, and it is 1:45 right now, I believe. So we're going to start this back up again at 2:45.
Quick question about what you just
Yes.
Does it matter which side the load was when you are compressing when he's at the rack?
It's basically both sides at the same time anyways, because the ground is pushing up and the weight is pushing down. So it squeezes them in the middle. Yeah.
And
Awesome.
How are you choosing load? How are you choosing load?
I asked him, does that feel okay? You're good.
So how often do I have to do that?
Well, I mean, like, if you need more motion or something like that, you could do it before you train. You know, like,
I'm saying it's something that like I'd have to do like on a daily basis as
you
training.
feel pretty different, don't you, from it?
Well, I won't move a little bit. But
Yeah. You'll notice the feeling.
Right.
When you lose the feeling, it's
Time to do it again.
maybe, yeah. Use measurements to guide you. You know, you can self-analyze infrasternal angle.
Right.
You know, you can have somebody else check arms and legs.
Right.
So it's, No idea. Who knows? Yeah, I mean, probably feels pretty good though.
Yeah, it was nice.
Yeah.
That right leg with the lack of IR is going.
I mean, I feel like that's a pretty dramatic intervention. That's the lowest effort intervention I can possibly think of. I can give exercises to change table tests, and we can show that after the break. But, why run when you can walk, and why walk when you can stand still, and why stand still when you can sit down, and why sit when you can lay down? Just doesn't make any damn sense. Okay? Like, why would I pay triple the price for the same TV that I could have for 20% off? It doesn't make any damn sense. So to me, that's the laziest, smartest way to get to where you're going. And then just work out and manage your workout with sensory motor competencies, and it'll probably hold on to these things. So, all right, let's eat.